All right, good evening, everyone, and welcome to the VA Long Beach Women Veterans Town Hall. I'm Alyssa Rivas, Deputy Public Affairs Officer here at VA Long Beach and an Air Force veteran. Thank you so much for joining us for this live interactive event. We have a meaningful program lined up for you tonight, including presentations, live polls, and a dedicated Q&A session toward the end of the call. We'll do our best to address as many questions as possible, and anything we can't get to, we'll follow up with after the event. Please keep in mind that we may not be able to answer personal healthcare questions during the call due to HIPAA requirements, but rest assured, we review every comment and will provide follow-up as needed after the town hall. If you're on your phone and want to watch the stream, press *8 for a link via text or visit access.live/VA Long Beach. We're also live on Facebook. And if you want to ask a question, you can press *3 at any time and you'll be put in line to ask your question or leave a comment. If you're watching online, just type your name and question below the video. We're only taking questions on the website. Facebook questions will be answered afterward. We're trying a new approach tonight by reaching out to more women veterans in the area, including those not currently enrolled in VA Long Beach Healthcare. Our goal is to share information about available VA health services and encourage eligible women veterans to connect with VA for their care. We invite you to join us this evening to learn more and consider enrolling at your local VA facility. Each veteran selects one VA healthcare system as their primary provider. To find the nearest VA location, visit va.gov/find-locations. Now, we'll go ahead and start off with understanding your VA benefits for women veterans with Tanisha Slaughter.
Good morning, everyone. Good evening, everyone, and welcome. My name is Tanisha Slaughter, and I'm a Congressional Liaison with the Department of Veterans Affairs, Los Angeles Regional Benefits Office. I recognize that today's topic may be personal for some of you, and I want you to know that my goal is to create a welcoming and respectful environment for everyone. So next slide, if the slides are being shown. Okay, I'd like to begin by giving you a quick roadmap of where we're headed today. We'll start by talking about military sexual trauma, or MST, and the support available through the VA. From there, we'll look at benefits and services that may be available, discuss the claims process, review evidence and best practices, then wrap up with the resources and support. Okay, slide 3, if you're, okay. Now, let's begin by talking about military sexual trauma, or MST. Military sexual trauma is the term the Department of Veterans Affairs uses to describe the experiences of sexual assault or repeated threatening sexual harassment that occurred during military service. One thing I like to emphasize is that MST can affect veterans from every branch of service, every rank, and every background. While today's presentation focuses on women's veterans, it's important to know that MST can affect anyone. So if you are a veteran online that has been affected by MST, I just want you to know that VA is here for you, support is available, care is available, and you don't have to navigate the journey alone. Today's presentation is about helping you better understand what those resources are and how to connect with them. Next slide, please. Now that we've talked about military sexual trauma, or MST, let's take a look at some of the benefits and services that may be available through the Department of Veterans Affairs. Before we look at the different programs, I'd like to point out that benefits and services may vary based upon the individual eligibility. That's important because every veteran's journey, circumstances, and needs are unique. When many people think about VA, they often think about two things: VA healthcare and VA benefits, VA disability benefits. Those are certainly important parts of what we do, What many veterans discover is that the VA offers many additional programs and services that may also be available dependent on their individual needs and eligibility, such as educational benefits, vocational rehabilitation, what's been changed, vocational readiness and employment benefits, also known as VRNE, home loan guarantee benefits, and other benefits. And so one key takeaway is that the VA is much more than health care or disability benefits. It's a network of programs, services, and resources designed to support veterans throughout different stages of life. And, okay, so the purpose of this is so that you will become familiar with those resources so you'll know where to start, where to go for help, and understand that you don't have to navigate the process alone. Next slide. As we continue, I'd like to talk briefly about some of the conditions that may be associated with military sexual trauma. One word I like to emphasize is may, possibly. The examples provided are not intended to suggest that every veteran will experience these conditions or that it is a complete list. Every veteran's experience is unique, and the effects of trauma can vary from person to person. Some veterans may experience mental health conditions such as PTSD or depressions, while others may experience physical symptoms such as chronic pain, headaches, and migraines. Some may experience emotional or cognitive changes such as sleep disturbances, memory and concentration, and use disorders or eating disorders. The purpose of this information is to simply help you understand that military sexual trauma can affect individuals in different ways, and no two experiences are exactly alike. It's also important to remember that having a diagnosis alone does not automatically establish service connection. VA evaluates each claim individually based on the evidence and applicable laws and regulations. If you recognize yourself in any of the examples, I hope you leave today knowing that support is available and that you don't have to navigate the process alone. So next slide, please. All right, so the claims process. Now let's take a look at the claims process. One of the questions veterans often have is, what happens after I file a claim? Well, the process begins by filing a claim. Once your claim is received, VA reviews the evidence that was submitted. Depending on the circumstances of your claim, additional evidence may be requested, or a compensation and pension, also known as C&P exam, may be scheduled if one is needed. After all the necessary evidence has been gathered and reviewed, VA makes a decision based on the evidence and applicable laws and regulations. Once that decision has been made, you will receive a decision letter explaining the outcome. So while every claim is unique and timelines can vary, I hope this overview helps make the process feel a little more familiar and a little less overwhelming. And remember, you don't have to navigate this process by yourself. If you have questions along the way, there are VA employees, accredited representatives, and veteran service organizations available to help guide you through the process. Next slide, please. So, evidence and best practices. I'm going to just provide you with a few evidence that you can submit to help support your claim and a few best practices. This is not inclusive of a list of all of the evidence and best practices, but some evidence is personal statement you can submit, medical or counseling records, service or treatment records, and a few best practices are just be honest and detailed, submit evidence early as possible, and attend your scheduled exams. The key takeaway is every veteran's experience is different. There is no single type of evidence required for every MST-related claim. So, next slide, please. Resources and support. So we covered a lot of information today, and I want to close the informational portion of our presentation by highlighting some of the resources available to support you, such as the Women's Veterans Program. The website is in the slides if you're able to see it. If not, we will provide that to you. The VBA MSP coordinator, her name is Miss Elaine Little. Her phone number is provided in the slide. If you need that, we can provide that to you. The VA Vera appointments, that's if you would like to speak to a VA representative to discuss your claim. You can make an appointment, and a VA representative will call you at an available date and time of your choice. And also the Veterans Crisis Line, we have the phone number here on the slide, but if you need it, we can provide that to you. The VA benefits information, you can get that at va.gov, and VA accredited representative, if you need one, you can get that at va.gov. The important thing to remember is that you don't have to know everything before reaching out. Sometimes the hardest step is simply knowing where to begin. These resources are here to help answer your questions, connect you with the appropriate services, and guide you through the process. Remember, you don't have to navigate this journey alone. The VA and its partners are here to support you every step of the way. Next slide, please. Okay, so on behalf of the Department of Veterans Affairs, Los Angeles Regional Office, to all of the veterans here today, thank you for your service. I'd like to leave you with 4 thoughts that I hope you remember long after this presentation, and they are: 1, your service matters; 2, your experience matters; 3, you do not have to navigate this process alone; and 4, we are honored to continue serving those who serve. It has truly been my pleasure spending this time with you today, and I hope you leave feeling more informed, more confident in knowing we're here, where to turn if you ever need assistance. So next slide, please. This will be the slide where I ask questions, but we're going to answer questions towards the end. So this concludes my presentation for today. Thank you very much for being here.
All right. Thank you, Ms. Slaughter. All right. We're going to ask our first poll question. So you can vote by pressing the corresponding number on your keypad. If you're online, you can vote by selecting your response below the streaming player. So, if offered after hours, which day of the week would you choose for a 30-minute focused PAP exam? 1, Tuesday from 4:30 to 7 p.m. 2, Wednesday from 4:30 to 7 p.m. 3, Thursday from 4:30 to 7 p.m. or 4, Saturday from 8 a.m. to 2 p.m. All right, we'll have those results for you in a few minutes, but now we'll hear from Dr. Tammy LaTourette about key information and resources for military sexual trauma.
All right, thank you so much. My name is Dr. Tammy LaTourette, and I am the Military Sexual Trauma Coordinator at VA Long Beach, as well as a staff psychologist. And I'd like to share with you some services that are available at our VA that are helpful to MST survivors. I'll refer to military sexual trauma going forward as MST. I'll also talk about how to get started with these services and also address some common eligibility concerns. Next slide. Oh, thank you. All right. So I'll talk about eligibility concerns first. You may have the question, am I eligible to receive MST-related care at the VA? So if you are not already receiving VA services, the first question you may have is if you are not already receiving VA services is whether or not you're eligible. And I'm going to address some of these common questions that veterans have regarding eligibility. Next slide. So one of the questions is, what if I didn't report MST when it happened? It's important to note that reporting is not a requirement for receiving MST-related care at VA. There are many reasons that survivors do not report at the time, including fear of retaliation or of not being believed, concern about the impact on their career or unit, shame, self-blame, and wanting to move on, not recognizing the experience as MST at the time, and not knowing that help was available. Whatever your reason, you can still receive care today. Another question, sorry, next slide. What about my length of service or discharge status? So standard length of service requirements do not apply to eligibility for MST-related care. They do not apply. MST-related care is available to veterans and most former service members with other than honorable or uncharacterized discharges. Next slide. What about National Guard and Reserves members? So former National Guard and Reserves members discharged under honorable conditions or with an other than honorable discharge can also receive MST-related care if they have one of two things: either federal active duty service or a service-connected disability. Important to note that the service-connected disability does not need to be related to one's experience of MST. So you could be service-connected for tinnitus and still be eligible to receive MST-related care through VA. All right, next slide. Good. What if I am a current service member? So current service members can receive MST-related mental health counseling at vet centers. No Tricare referral is needed. You can also receive MST-related care at VA medical facilities, but a Tricare referral is required in most cases, and general Tricare copayment requirements may apply. Important to note that DoD does not have access to vet center records, but DoD does have access to VA medical facility records. Next slide. All right, what if I'm not eligible for VA care? So any veteran or service member, including members of the National Guard and Reserve Forces who experience MST, is eligible to receive counseling at vet centers, regardless of discharge status. Okay. All right, I'm going to talk now about some services that are available to MST survivors through VA Long Beach. Medical services. So MST survivors may have medical conditions that are either the direct result of MST or conditions that are exacerbated because of their experience of MST or the behavioral attempts to cope with MST. And there can be a lot of different ones there. Psychiatry services offers medical treatment for mental health conditions, and there are several different treatment options, including medication. VA also offers evidence-based individual and group psychotherapy. We also offer couples counseling. We know MST is an interpersonal trauma that affects trust and can negatively impact relationships. Women's mental health at VA Long Beach is integrated throughout our programs. You may request a female provider, and you may enroll in one of our many women-only psychotherapy groups. This care is also available in our specialty programs that I'm going to talk about next. We have an addiction recovery treatment program. We also have a PTSD clinic. We have a comprehensive DBT program, dialectical behavior therapy program, that offers a higher level of care for veterans who are at high risk of suicide or other self-harm due to difficulties in regulating emotions. Suicide prevention program helps high-risk veterans with follow-up and support as well as therapy options. We also have whole health options, which emphasizes understanding each veteran's values, goals, and life purpose and integrating those into personalized health planning with a variety of class offerings. We also have a peer support program that uses trained, certified veteran peer specialists. So these are VA employees with lived experience of mental health recovery to support other veterans in achieving wellness and recovery goals, offering one-on-one support, groups, and telehealth services. VA also offers chaplain services. All right, now how to get started. So if you are not already enrolled or registered with the VA, that will be the first step, is to enroll. If you are not enrolled or registered and perhaps you're not eligible for the complete Veterans Benefits package at VA due to not meeting minimum service requirements, or perhaps you have an other than honorable or uncharacterized discharge, you may register for clinical evaluation rather than enroll. During that clinical evaluation, they will ask you if you've experienced MST. A clinician will ask, and then you can get services, MST-related services, going forward. So you want to enroll or register at the VA. You can seek a primary care appointment to address MST-related medical conditions. You can seek a mental health evaluation to address MST-related mental health conditions. You can do this through psychiatry. You can do this through a warm handoff from your primary care provider to a mental health provider, and you can also do this through our urgent mental health clinic. From there, you can receive the referrals that you need to move forward from there. All right, and I want to thank you all for allowing me the opportunity to share about MST-related services and how to get started. If you still have some eligibility concerns and you've been turned away, sometimes if you've attempted to enroll at the VA before and you have humanitarian status in your chart, but you meet some of those requirements that I mentioned earlier, you might be eligible for care. There might be something in your chart called Special Treatment Authority care. If that eligibility is in there, you are eligible. So please reach out to me if you need some help and some advocating on your behalf. And my number is on that final screen there. Thank you.
All right. Thank you, Dr. LaTourette. And just a reminder, press *3 on your keypad at any time to get into the queue to ask a question. If you're participating online, you can submit your question below the streaming player. And then we also have our results from our first poll question. So we asked, if offered after hours, which day of the week would you choose for a 30-minute focused PAP exam? And it looks like, oh man, we're kind of equal, but I think Saturday from 8 a.m. to 2 p.m. won out with 33%. So we appreciate your feedback. Our Women Veterans Program will be working with this information for the future. So next up, we're going to be hearing from Genevieve Cross about VA healthcare registration and eligibility.
Good evening. First and foremost, thank you for your service, and as well, thank you for joining us tonight. I'm here with eligibility and registration, just to hit on a few topics for you. First and foremost, if anyone can see the slides, if you enlisted after September 7th, 1980, or entered active duty after October 16th, 1981, you must have served 24 consecutive continuous months or the full period for which you have called to active duty, unless any of the descriptions below are true for you. There are many ways to register. Preferred method, I would strongly suggest either with us in person at Long Beach, VA, anytime Monday through Friday, 8 to 3. We will get you into the system and you will have your definitive answer on the spot. We can also walk you through it and start your care, get you set up with a primary care, what have you. The secondary, highly suggested way is through headquarters. Toward the end of the slides, I will provide you that phone number. Your health care benefits are what you earned serving your country, and we can help walk you through that. Reserves and National Guards. Normally, that time does not count toward VA health care, but there are ways around it. If you are Title 10 activation, you've been called to duty by the federal order and completed a full period for which you have called or ordered to active duty. If you have been called to duty and have only had active duty for training purposes only, that does not necessarily qualify you for VA health care. We can work around that. There is VA Service Connections, as has been mentioned earlier, but do not get discouraged. There's still ways to access health care benefits. If you meet the basic service and discharge requirements and were exposed to toxins or other hazards, namely TERA is the process, while serving our country at home or abroad, environmental toxins, they're included with Vietnam War, Gulf War, Iraq, Afghanistan. There are burn pits, there are Agent Orange, you know of Camp Lejeune. There's many other qualifications that you may fall under. If you served anywhere that could have been exposed to environmental toxins, we would like to help monitor your health and get you the health care that you deserve. This is quite an extensive list. You may also qualify for advanced eligibility status if you meet the minimum active duty service and discharge requirements and at least one of the descriptions that are listed on this slide for those who can see it. There's so many ways. There's so many ways that we can help you further. What if you don't qualify? What if these circumstances do not apply to you? It's still possible to access VA health care. If none of the previous stated qualifications apply to your situation, having a VA-rated service connection disability will override the qualification requirements and grant you full access to health care. One thing that is not always brought to vets' attention is that without enhanced qualifications, there is also an income threshold that can disqualify a vet for health care. Service connections and enhanced eligibilities prevent that from happening. Here at Long Beach, we register in person on a walk-in basis. Come in anytime Monday through Friday, 8 to 3. We are located right inside the main tower building of the front entrance. Please bring your DD-214 printed, a current valid ID or passport. If you have any dependents, their information, for instance, name, date of birth, social, and know the estimated of your gross financial income from last year. The entire process from start to finish usually takes about half an hour to 45 minutes. We'll get you into the system. We'll explain to you how to establish your health care. We'll walk you through it. It's a lot more personal experience than doing this online or doing this over the phone with headquarters. If you have questions, we will be happy to answer them on the spot for you. If you do need to contact headquarters, give me 1 second. Headquarters is on the East Coast. They are the only ones who are able to register in person, over the phone. You can reach them at 877-222-8387. I believe this is already covered, but I'll cover it a little bit more. Service connection benefits. VA benefits are yours and yours alone to claim. Your military service benefits can help create a better life for you and the generations that come after you. Like I said before, these are benefits earned by you by serving your country. We would love to help you get into these, get your services, and help just make life a little easier. Something that was not mentioned on this slide, but my supervisor wanted me to include, there is also something called beneficiary travel. That is where the VA is able to help reimburse you your mileage to and from your appointments. It's a completely separate department, but we will be happy to help navigate you to that department as well to gain even more benefits. That's pretty much it for my part. Thank you all for your sacrifices, and thank you all for your service. Have a good night.
All right. Thank you, Ms. Cross, for all that awesome information. All right, everyone. We're going to go to our second poll question here. So remember, you can vote by pressing the corresponding number on your keypad, and if you're online, you can vote by selecting your response below the streaming player. All right, question number 2. If offered after hours, which days of the week would you choose for a screening mammogram? And 1, Tuesday, 4:30 to 7 p.m., 2, Wednesday, 4:30 to 7 p.m., 3, Thursday from 4:30 to 7 p.m., or 4, Saturday from 8 a.m. to 2 p.m. All right. Just another reminder as well, if you have a question, you can press *3 on your keypad at any time to get into the queue to ask a question. If you're participating online, you can submit your question below the streaming player. And now we will hear from Dee Strobel-Lucas about Women's Health Updates.
Hello, and thank you for being here this evening. As Alyssa mentioned earlier, today's call is reaching out to many more female veterans in the area to give you a taste of what's available when you enroll at your local VA. Every veteran can choose one VA system to belong to, and you can find accessible VA locations at va.gov/find locations. So remember, go to the VA homepage at va.gov, click on Find a VA Location, then type in your zip code and search for available VA health facilities and resources in your area, and we hope you'll consider enrolling at your local VA. Women Veterans Health Care. Women Veterans Health Care can be found throughout VA Long Beach. We would like to highlight 3 areas: primary care, mental health, and gynecology, who all work together to provide gender-specific care. VA's style of care is unique for women veterans. An assigned women's health provider will manage primary care and gender-specific care. Gender-specific care includes pap smears, mammograms, birth control, preconception counseling, HPV vaccine, and menopausal support. Gender-specific mental health care offers both individual and group therapy options. There's a range of evidence-based treatments for reproductive mental health, for trauma, depression, anxiety, race-based stress and trauma, and relational concerns. There's also mental health consultation and treatment during pregnancy and breastfeeding. Gynecology provides infertility evaluation, treatment for menstrual disorders, treatment for pelvic pain, surgical options, maternity care coordination, and transgender care. VA Long Beach also offers extended pap smear exam clinics once a month. There's an option for Thursday evening clinic every 30 minutes from 4:30 p.m. to 7 p.m., and Saturday clinic every 30 minutes between 8 a.m. and 2 p.m. The Women's Move program. This is led by one of our wonderful dietitians, and the Women's Move program is a weight management program. It offers a safe space for female veterans to incorporate weight management topics tailored to female veterans of all ages. It's a 14-week program starting October 7th of this year, October 7th, 2026, and offers 1-hour sessions by VA Video Connect. That's a virtual session on Wednesdays at 11 a.m. To enroll, call VA Long Beach at 562-826-8000. Again, that's good to load in your phone, VA Long Beach at 562-826-8000, and dial extension 12980 to enroll in the Women's Move program. Lactation education. Did you know that VA Long Beach offers lactation education for veterans enrolled in VA healthcare? So if you're interested in learning more about breastfeeding and lactation, or even learn more about the VA Maternity Care Benefits program, reach out to the Maternity Care Coordinator team at VA Long Beach. Dial extension 14709 or 14988. Women Owning Wellness. If you're interested in improving physical and mental well-being in an all-female group, consider joining Women Owning Wellness. This is a 12-week class on Tuesdays from 1 to 3 p.m. for an in-person option, or Thursdays via VA Video Connect. It's a one-on-one virtual 1-hour class option. But this class includes discussion, Tai Chi, physical activities, mindfulness exercises. And so for more information, contact Gladys Yu, and the phone number is 562-966-2875. 966-2875. Peer-led support and wellness groups for women veterans. There are several options. Pursuing Happiness is a group for women to explore what truly matters, share experiences, and support each other in building happier, more fulfilling lives. Unstoppable Warriors, Navigating Life's Changes. This is a peer-facilitated support for menopause challenges. It's a safe space to share, learn coping strategies, and empower each other through life's transitions, guided by VA peer specialists. Artful Adventures. This is a creative arts in the garden, no experience required. Enjoy nature, try new creative activities, and build lasting connections. Come as you are, everyone is welcome. All groups are veteran-centered, supportive, and open to all women veterans looking to connect, imagine, and grow. You can contact Sandra Greenman, our certified peer specialist, and she's here this evening available for questions and answers if you have questions. Women Veterans Photo Club. Join us via Zoom on Thursdays from 10 a.m. to noon. And to sign up, contact Teresa Solis. There's an email on the slide, or I'm going to say it, Women Veterans Photo Club, that's all one long word, Women Veterans Photo Club at gmail.com for the photo club. And now, back to Alyssa for our next poll question.
All right. Thank you, Ms. Strobel-Lucas, for all those updates. And let's take a look at the results of our second poll question. Again, we asked, if offered after hours, which day of the week would you choose for a screening mammogram? And it looks like we have an overwhelming 51% for Saturday from 8 a.m. to 2 p.m. So thank you for that feedback. By giving us your answer, we're helping our Women Veterans program help you. So thank you for those. All right. So it looks like we're going to be moving into our Q&A portion here. Again, if you have a question, you can press *3 on your keypad at any time to get into the queue to ask that question. If you are participating online, you can submit your question below the streaming player. Let's take a look at what we've got. It looks like our first question here, you're calling me, but I live in Temecula. Where should I go?
All right, this is Lori, Women Veterans Program Manager, and I appreciate that question. It's a great example of why we extended this town hall a little wider. You could go to the VA locator, and I'm going to spell it out. It's va.gov/find locations. What you're going to do is you're going to enter your zip code and then pick the VA for facility type, and you'll see a list of clinics that are near you, okay? And so you want to look at the big ones are called like VA hospital or medical center. Those are the big VA healthcare systems. The ones that are called clinic, they're little satellite clinics and part of the same systems. So for you in Temecula, you might see Marietta VA Clinic, which is close to you, and if you click on it, you'll see it's a satellite of the Loma Linda VA healthcare system. Okay, so this means you'll get the most of your basic care very close to you at the Murrieta Satellite Clinic. And when you need specialty care, you would get it at the main Loma Linda VA medical site.
All right. Well, we have a question for Dr. Ung, who is our whole health. I already registered with VBA. Should I enroll for health care?
Great question. So while you are already registered with the Veterans Benefits Administration, the Veterans Health Administration is separate. So yes, absolutely enroll with the Veterans Health Administration. That way you can get health care and get access to many different resources, and you never know when you will need them. So strongly recommend doing that. And we heard registration and eligibility speak earlier, and they are the experts on all things when it comes to enrollment. Thank you.
All right, thank you. We do have questions about seeing the slides and recording later. So this whole presentation is actually streaming live on Facebook right now, and we will have actually a video archive of this whole presentation as well that will be posted on Facebook once we close out tonight. So be looking for that on our Facebook. We are at VA Long Beach Healthcare System, so make sure you check us out also for updates or any events that are going on here at the facility as well. All right, looks like we've got a question maybe for social work and VBA. We have some questions about housing access and programs and navigating those challenges. Let's hear from our social work first. Megan, if you want to come on, and then we can listen to Tanisha from VBA.
Yeah, hi everyone. My name is Megan Mortensen, and I am the social worker with the Women's Health Clinic. This is a really great question. We have a lot of different housing resources available through Long Beach VA, some varying with wait times to help fit your needs. So a great thing to do is to reach out to your primary care social worker if you are assigned one. For Women's Health Clinic, that would be me. If you are not assigned with a primary care social worker at Long Beach, you can still speak with a social worker through our Veteran Resource Center. Some of those programs include transitional housing through our Grant and Per Diem program. This is where you can stay for up to 2 years. Typically, and this can vary depending on your situation, but typically we try to get veterans into that transitional housing program within a few days up to a week, depending on bed availability. We also work with a community program called SSVF. This is where the VA works with community partners to address the needs of veterans who are either homeless or at imminent risk of becoming homeless. This program can help veterans find a new apartment, can assist with moving costs, security deposits, things of that nature. In this program, typically we can get people linked up to it within a week or so. And then we also have a program at the VA called HUD-VASH, which is a partnership with the Housing Authority, and it's where veterans who are homeless or at imminent risk of becoming homeless can receive a Section 8 voucher that they can utilize to rent an apartment. That program, because of the nature of the program and the nature of the Housing Authority, that program can take a little bit longer to establish. But we do try to work with all veterans in the meantime to make sure that they have safe housing through transitional housing or SSVF. So if you are struggling with your housing, please reach out to, like I said, either your primary care social worker or the Veterans Resource Center, so we can get that process started for you. If you already are linked with our homeless program and you're wanting to get updates, find out where you are in the process, you can also reach out to myself or your primary care social worker, and we can help facilitate that conversation and advocate for you so that you can get into housing in a more timely way. Thank you.
All right, thank you for that. And then Tanisha from VBA, do you have anything else to add?
Well, the only thing I would add is that for veterans that are homeless, they can fill out a VA form 20-10207. When they fill out that form, it can potentially get their claim expedited. And so for homeless veterans, they can fill out that form. And also, if you're experiencing a hardship, you can fill out that form. But you will have to, on the form, it tells what particular evidence you have to provide to support your hardship. But if you're homeless, you just fill out that form, and we can expedite your claim, the processing of it. So that's what I wanted to add.
What was the form number again?
It's VA form 20-10207.
Okay, perfect. Thank you so much for that. And remember that each VA will have lots of different services. So to all our veterans out there, let's get connected. They're going to know your community best and what's out there. So, all right, our next question is going to be for eligibility. Why would my income disqualify me from VA healthcare? I'm still a veteran and I served my country.
Good evening. This is Jeanette Cross from Eligibility and Registration again. Unfortunately, that is something that was set into place by the higher-ups. Like I said, there are enhanced eligibilities, and there's also service connections that can work around those. and all of us can help you find a way to navigate and get your full health care benefits.
All right, thank you. All right, and then a question for Tanisha from VBA again. That's a question about how to navigate sensitive applications for MST, and a question about evidence and trauma impacting.
So they want to know how to navigate. Could you repeat that question?
Yeah,
you just said my name. It came out of nowhere.
Sorry. Yeah, it's a question about how to navigate sensitive application for MST. I guess their question is about evidence and trauma impacting. If we get some assistance also from maybe Dr. LaTourette, I don't know if you can add to this as well.
Well, I mean, to navigate through that, it's best to speak to a MST coordinator. And here at the Veterans Benefits Administration, we have an MST coordinator, and her name is Elaine Little, and I can provide her phone number, and she will be able to speak to you one-on-one about MST related concerns. And it's a way to navigate, just like you said, when it's really sensitive. Let me give you her information. Her phone number is 310-808-4399. And so when you call her, she won't pick up. She doesn't have a voicemail on it. This type of systems is not a voicemail. So you just leave your name. It's going to ask you for your name. And then if she's available, she'll pick up. If not, leave a message. And then she'll give you a call right back, at her earliest convenience. But she's the best resource for the VBA when, to navigate around the sensitive information, to go to your MST coordinator.
Okay, awesome. Thank you for that information. All right, our next question. I have not been able to find any dental insurance for women veterans, and I'm over 70. Can you help?
I hope so, Alyssa. This is Dr. Vezirani. I'm the Acting Chief of Staff at VA Long Beach. I'm so glad y'all are listening into this really important phone call. Getting dental insurance is a challenge for every person, and veterans included, but it's really important that you maintain dental hygiene because it's important for your overall health too. If you don't qualify for VA dental, you can check out what's called VA DIP, so Dog Indigo Parrot, which stands for Dental Insurance Program. And those are discounted private dental insurances for veterans and family members who meet certain requirements. The VA DIP plans cover many common dental procedures, and the cost for your coverage will depend on the insurance company and the plan you choose. So you can go to va.gov and just search VA DIP, and again, which stands for Dental Insurance Program, and see what options you have in your area. And you can also reach out to your primary care social worker at your own VA because they're great with resources in your local community looking for low-cost dental clinics or other insurance options such as Medi-Cal.
All right. Thank you so much for that. All right. Sandra, we want to hear from you. Can I hear more about the wellness groups that are just for women? Got a great resource coming up for you.
Good evening, everybody. I'm Sandra, peer specialist. I work within the Women's Mental Health Clinic here at the Long Beach VA. I'm a veteran myself, U.S. Navy. And Dorothy was kind enough to mention a lot of the groups that I run on the wellness slides. So I'm a veteran who's walked the path myself. And so I offer a lot of groups that I thought would help me back when I was navigating my journey. And most of my groups are put in place, either I navigated it or there was a big need for it, especially my menopause support group, feeling like you're kind of like living in a bubble and nobody gets it and you're not sure if what you're feeling is related to menopause or something else. But we come together in a supportive, non-judgmental space to just help each other. All of my groups are in place to help build community, camaraderie, to have more of a support system. As women veterans, we are warriors. We can do a lot of things, but sometimes we don't ask for help for ourselves. And so this is an opportunity to come together, to be around other women who just get it without you really having to say anything. I have a ton of groups. So the Persist is based in positive psychology, focusing more on our strengths instead of what's going wrong. I have the menopause group that's on Wednesdays. And by the way, all of my groups, most of them are virtual. The arts and crafts group is in person on Fridays in the VA Patient Garden, a wonderful, beautiful space. I also do a Taking Charge of My Life and Health group on Thursdays virtually. And I'm incorporating a new group called Honest, Open, and Proud, which is to reduce the stigma surrounding mental health and to know when and where to tell our stories and who to tell it to.
All right. Thank you so much for that. All right. Our next question is for eligibility again. It's 2026. Isn't there a way to start healthcare online? I had to do everything else online.
Good evening again. This is Janelle Lynn from Registration and Eligibility. There are ways to do this online. I highly, highly suggest you come in and give us half an hour of your time and we will take care of it A to Z. When you do it online, a lot of times the delay in getting response back is sometimes 3 to 4 months. If you cannot come in to Long Beach in person, I strongly suggest perhaps you call the HEC number that I provided earlier, the 877 number, where they can get this done for you over the phone and give you a definitive answer.
All right. Okay, our next question is, I had MST and coming to the VA is really triggering for me, and last time I went, they said I did not qualify.
Okay, this is Dr. Tammy Lautrette again, the Military Sexual Trauma Coordinator. In my presentation, I talked about some eligibility concerns. If you have been told you aren't eligible because maybe you didn't meet the minimum service requirements or have an other than honorable or uncharacterized discharge, you may indeed be eligible for MST-related care. If you haven't registered or enrolled and you aren't eligible for the full Veterans Benefits Package, you're going to want to ask to register for a clinical evaluation. You'll be able to meet with a clinician who will ask you about MST. That's one way to get that in your chart so that you can start receiving MST-related services. And if you are still getting turned away, MST is in your chart, and you have a strong feeling that you are eligible. Sometimes there's something that happens when someone tries to get enrolled and it says humanitarian status, do not schedule. That can be a big barrier to care, and it's not always true. If that Special Treatment Authority care is in your eligibility in your chart, you are eligible. If you are running into those barriers, please reach out to me. My number is 562-967-0354, and my name is Dr. Tammy Lautrette. You can also call the VA main line and ask for the MST coordinator, and they'll send you my way, and I can help advocate for you.
All right, thank you so much. Really appreciate that. All right, our next question. There were a few questions about addiction programs. Can you speak to this?
Hi, yes, I'm Dr. Lilia Shainman. I'm the program manager for the Addiction Recovery Treatment Program, and I'm so excited to be invited to speak with you all today. We have done a lot of work in the addiction program to create spaces for women veterans. We actually now offer several women's-only groups that are virtual. And we have female psychotherapists, we have female group facilitators, female treatment coordinators, and female psychiatric providers. And I'm happy to answer any specific questions. You can always get a hold of us by calling the main number and asking for the addiction program. We are now the Addiction Recovery Treatment Program. Our name has changed over the years, but we would love to help you meet your goals. Just find us.
All right, and that main phone number is going to be our
main number, yeah, thank you. It's the 562-826-8000, and our direct extension is 5610, so you can dial 1-5610, or ask anyone who picks up for the Addiction Recovery Treatment Program.
All right. Awesome. Thank you so much for that. All right. Our next question is for Dorothy. I'm assuming this is they got a Navy Med board and got Tricare for life. They still have to get VA. What's the difference?
Hi, this is Dorothy, one of the maternity care coordinators. So Tricare, Tricare for life is like an insurance policy that you have, like Tricare when you were in active duty. It works like a regular insurance program, but VA healthcare is separate. It's a benefits package, and it's care within the VA healthcare system. So everyone's situation is unique. It's hard to say which is going to be the better or best option for you, so would recommend that you research your Tricare insurance, such as any cost of co-pays and co-shares, like if you have a hospital admission, those kinds of things. And then talk with the VA eligibility and enrollment folks to see if you would have co-pays or what they would be, and so that you can compare both programs together and see what's the best fit for you.
And I always tell people, it's always a great idea to keep the VA in your back pocket. It's a benefit that, you earned, so definitely look it up. And also, the VA is very intimately familiar with veteran issues. Obviously, that's who we serve. So definitely a good idea to just, talk to somebody from eligibility and see where that goes. All right, and then we've got one last question here. I saw a slide about breastfeeding. Why?
Oh, great question. Really glad you joined today and asked. Well, the VA does have a maternity care coordination program, and we actually have 180 maternity veterans at VA Long Beach, and we really like to get the word out. Many women veterans don't know that the VA can assist with maternity care for eligible enrolled women veterans. And although the VA, we don't do prenatal care or delivery babies at the VA hospitals, we can help pregnant veterans get connected and covered for care through the VA Community Care Program. This means that the VA covers the prenatal care and delivery out in the community with a community OB provider. And the veteran also has access to care coordinators like me who keep an eye on them, help them access care, check on them throughout pregnancy and throughout the first year postpartum. And we teach and coach them for things like breastfeeding, help getting connected for mental health support and other items too.
All right. Fantastic. Again, there are lots of services available if you just connect with the VA. So I really urge you to go reach out to our eligibility office or the eligibility office of the VA that's closest to you, just to get started and get a primary care appointment. So there's so many resources out there that flow actually from that primary care appointment, a lot of referrals and connections from there. So go ahead and call that eligibility office for whatever VA is closest to you, and that we would love to see you come through our doors. So with that, I'm going to go ahead and thank you for joining us for the Women Veterans Town Hall with the VA Long Beach Healthcare System Women's Health Team. We truly appreciate the chance to connect directly with our women veterans and address your questions. We hope that this was helpful for you all as well. And we're looking forward to hosting our next Women Veterans Town Hall to keep you updated on our ongoing efforts and upcoming events. If we missed your question or if you have suggestions for future topics, you can contact Lori Rudisil at 562-826-5617. Thank you again. Thank you for your service, and have a wonderful evening.